Alrighty, so it is 7 o'clock. I mean 6 o'clock. I apologize. I'm on Eastern time. Good evening, everyone, and thank you for joining our Men's Health webinar. My name is Kate, and I will be your host for this evening. We'll start with a few housekeeping items, and then I'll introduce our speaker. First, your attendance tonight is completely anonymous to other attendees. No one can see your face or your name, and any comments or questions can only be seen by myself and our speaker. If you wish to ask a question, please type it in the chat box at the lower part of your screen, and we'll be sure to answer them at the end of this presentation. Our presentation tonight will last for approximately 1 hour and will be presented by Dr. Brian Christine. Dr. Christine, I know your time is very valuable, and we appreciate you taking time this evening. I'll go ahead and turn it over to you.
Good. Well, thank you. I appreciate it. My name is Brian Christine, and there you see that picture. I was a little bit younger when we took that picture, a little bit less gray hair. I am a urologic surgeon. I practice in Birmingham at a large group called Urology Centers of Alabama, and there's the information there. We actually have the number for our office on the screen, so if you need to call or contact us, you have that number available. I went to medical school over in Atlanta at Emory University. I'm originally from Augusta, Georgia. I went to Emory for my medical school. Then I came to the University of Alabama here in Birmingham for my training, my urology residency, and I decided to stay. I joined a large group that's here in Birmingham, and my function within the group is pretty specific. I don't take care of cancers. I really don't take care of females. I don't treat kidney stones unless perhaps I'm on call and it's an emergency. What I really focus on is men's health. And what I really sub focus on a lot is sexual health in men, erectile dysfunction, something called Peyronie's disease, which is curvature of the penis with an erection. I take care of hormone treatment, testosterone replacement. So that's what I do for the group. And that's why I'm here talking to y'all tonight. And I'm looking forward to to do the webinar. Kate, let me make sure. I just want to make sure I can advance my slides. And let's see. Good. So we're going to talk about erectile dysfunction tonight, and there's plenty of resources to help us men who have trouble with erections to get help. If you look on the screen there is this QR code that you can scan, and that way you can take a little quiz, kind of a self-assessment about erectile dysfunction. We certainly have websites that you can go to. You see the one that's there, the www.edcure.com. That's a great resource. Actually has some videos and good information. You can text EDCure there at the 73771, but there's great information how we can treat erectile dysfunction. And we have great resources for that because erectile dysfunction is incredibly important. It's incredibly common, as we're going to talk about tonight. We know that erectile dysfunction is present in over half of the men. So once a guy reaches age 40 and older, about half of the men in the United States have erectile dysfunction of some degree. So it's really, really common. It's common enough that that's what a large part of my practice is, treating men who have problems with erectile dysfunction. Now, when we talk about erectile dysfunction, what's an erection? And I know we all know about it, but just to kind of go through it, what happens is as we men get sexually aroused, the penis is going to fill with blood and going to engorge and get stiff, okay? As the penis stiffens up, there's actually a system of valves in the penis that compress to keep the blood from draining out. And the way things are supposed to work is that when we get sexually aroused, blood flows into the penis, we get a good hard erection, we're able to have sexual intimacy, and after we have an orgasm, then the valves kind of relax and the blood drains out of the penis. And so that's how things are supposed to work. And so what that means is that there are really two important things for us men to have an erection. We got to get the blood in and we got to trap the blood in. So both of those things have to happen for an erection to be a good usable erection, okay? Erectile dysfunction can be caused by different things. And so basically, if a man can't get a good hard erection or can't maintain that erection to have satisfactory sexual intimacy, then he's got erectile dysfunction. And there's a variety of things that can lead to erectile dysfunction. There are certainly medical causes. We know that diabetes and high blood pressure are probably the two most common reasons that men can have erectile dysfunction. Certainly, if you have lifestyle things that aren't very healthy, smoking, for instance, or perhaps a poor diet and obesity. All those things can contribute to erectile dysfunction. So it's not just one thing that leads to erectile dysfunction. And also, as we guys get older, erectile dysfunction becomes more common for sure. Good. And so erectile dysfunction, yeah, it is a physical problem. We can't get a hard penis. We can't get a hard erection. But any of y'all out there who have erectile dysfunction know that it's not only a physical problem. You know that, and if there are women out there, you know this too, that if a man can't get a good erection and have the sexual intimacy that he wants to have with the person that he really loves and respects and cares for, well, not only is it a physical problem, but there's also that emotional component. For better or for worse, I like to say it's the way the good Lord made us men. If we can't have sexual function and we can't get an erection, we just don't feel as good about ourselves. It really can cause depression. It can cause anxiety. So many of the men that I see and treat just don't feel good about themselves. And they'll say, doc, Brian, I just don't feel like a man. And that's part of erectile dysfunction too, not just a physical problem, but there's that emotional component as well. And it can certainly put a strain on a relationship for sure. Erectile dysfunction and diabetes. Like I said, diabetes is one of the major medical reasons that a man can have erectile dysfunction. So if you've got diabetes, you can have ED. It's really, really common. Okay. And if we think about that, why might that be? We can go ahead and do the next slide. If we think about that, why might that be? Well, diabetes affects blood vessels and it affects nerves. And you've got to have good, healthy blood vessels to get the blood into the penis for an erection. And you've got to have the nerves that carry the messages to the blood vessels to get blood in. So diabetes can have a negative effect on all that. So if a man's got diabetes, there's a good chance that he's going to have some trouble getting or maintaining an erection. Next slide. Good. Uh, as a guy has diabetes, if he's getting older, that can even lead to more potential for erectile dysfunction. If they don't have good control of their diabetes, that can affect or more likely to have erectile dysfunction. So when I see a man come to see me with erectile dysfunction, oftentimes they have diabetes. Not always, but it's really common. And then how about heart disease? What it says here is heart disease, and we're thinking more along the line of vascular disease because what's a heart attack? A heart attack is when the blood vessels, the arteries that go to the heart, they're called the coronary arteries. When they get blocked, they can't carry blood to the heart. And so you don't have the blood going to the heart to carry the oxygen and nutrients, and you can get damage to the heart muscle. Well, if what happens with a heart attack is that you're getting narrowing or the coronary arteries getting smaller so they can't carry blood, you can have that same process going on to the penis. Go ahead and go to the next slide. So we know that erectile dysfunction and heart disease are related. The thing is that the blood vessels, the arteries that carry blood to the penis are a lot smaller than the arteries that take blood to the heart. And so what that means is you think about it. If any of y'all out there are a plumber, if you've got a small pipe, it's much more likely to get blocked for your water flow if it gets, calcium or minerals on the inside than a bigger pipe. The arteries to the heart are bigger pipes. The arteries to the penis are pretty darn small pipes. And so erectile dysfunction is more common. And as a matter of fact, we know that if a man has erectile dysfunction, that's something he really should let his primary care doctor know about because that can mean you're at an increased risk for a heart attack later in life. What do we do? Well, you can't change your blood vessels, but you can certainly exercise, you can eat a better diet, you can avoid things like smoking. All of those things can be a help. And obviously you want to make sure that you see your doctor for annual checkups. I'm about to turn 61. I know how really important it is for me to see my doc for checkups every year to look for things like diabetes and high blood pressure and artery disease. So that's really important. All right, low testosterone. People really talk a lot about low testosterone these days. Testosterone is that hormone produced by the testicles. It's that chemical, that hormone that kind of makes men men. It's the hormone that makes men tend to have more muscles than women, have a deeper voice, have more body hair, and it also is definitely related to our libido or sexual desire. So as we men get older, testosterone levels tend to drop as men become obese. If a man becomes big and obese, that can affect testosterone levels. If your testosterone levels are low, it's going to give you symptoms. Okay. And I'm on testosterone because 6, 7 years ago, I checked my levels and they were low. And what did I experience? Well, less energy, less sexual desire, less libido, less, harder to keep muscle on, harder to keep fat off. All those things can be symptoms of low testosterone, and we can treat that. So we can treat a man with low testosterone. For me personally, I take testosterone injections. Every week I give myself an injection and that works great. And so that's probably the most common way that men get their low testosterone treated. There are oral medications and there are some gels that go on the skin. Honestly, for a lot of guys, though, they don't work as well. But for some men, they do. But testosterone self-injection, which is really easy to do, can help get that testosterone level up, give us more energy, help us to keep the body fat off, and absolutely increase our sexual desire. How about prostate cancer treatment? We hear so much about prostate cancer these days. Prostate cancer is the most common cancer in men in the United States. In other words, it's more common than any other cancer in men in the United States. Prostate cancer is something that can absolutely be treated. And there's different ways of treating prostate cancer. The key to curing prostate cancer is finding it early. And the key to finding prostate cancer early is to do annual screening. So every year for us white guys, age 50 and older, we need to start getting our PSA, which is a blood test that screens for prostate cancer. We get that checked every year. We get a rectal exam, which is a rectal exam, a finger up the bottom to feel the prostate to make sure it feels normal. In general, we white folks should start that at age 50 unless there's prostate cancer in the family, and we start that at age 40. For African American men, it's even more important to start earlier because we know that prostate cancer can come on earlier and more aggressively in our African American brothers. And so for African American men, for Black men, it's important to start at age 40 with your prostate cancer screening. Because again, if we check it, if we find prostate cancer early, we can treat it and almost always cure it. You can treat prostate cancer by removing the prostate surgically. You can treat prostate cancer in some men with radiation treatment. There's different ways to treat prostate cancer. If we find it early, we can cure it. And prostate cancer, like I said, is really, really common. And it's important to know that if we treat prostate cancer with surgery by removing the prostate, or we treat prostate cancer with radiation, that can cause erectile dysfunction, which doesn't mean you shouldn't be treated. It doesn't mean you shouldn't be screened for prostate cancer. We have to do those things. But the reality is, a lot of guys after treatment have trouble with erections. The truth is, we can treat that trouble with erections. We can get you back to having good erections. You got to get your prostate cancer screening. And if you have prostate cancer and it gets treated and there's problem with erections, I'm telling you, we can absolutely treat those things. All right, Peyronie's disease. I mentioned earlier on that part of my practice is treating Peyronie's disease. What is Peyronie's disease? Peyronie's disease is curvature of the penis with an erection. So a guy will come to see me, a patient come to see me and say, hey, Brian, you know what I noticed 6 months or a year ago when I would get a hard on, when I get an erection, my penis is bent up or it's bent to the side or bent down. That's Peyronie's disease. Peyronie's disease is not dangerous. It's not life-threatening. That curvature happens because of scar tissue that forms in the penis. And that's what that picture is showing. It's calling a plaque. It says a fibrous plaque. Well, that's scar tissue. Because when we have intercourse, when we're having penetrative sex and our penis is inside and we're entering and thrusting, there can be little microscopic tears in the deep tissue of the penis. And most men don't even know that's happening. When you get those tears in the tissue, the body will form scar tissue, and some men will develop curvature of Peyronie's disease. Again, it's not dangerous, but it can affect sexual function, and we can treat it. So again, like so many things when it comes to sexual issues, they can be treated, or these problems can be treated, and Peyronie's disease can be treated. For some men, we can inject medicine into that scar tissue in the office to break the scar tissue down. For some men, surgery to actually cut the scar tissue and to straighten the penis up. That's the best way to treat. Peyronie's disease is more common in men with erectile dysfunction. Now, listen to what I'm saying. Peyronie's disease does not cause erectile dysfunction. That doesn't happen. But a man who has erectile dysfunction has a penis that's not as stiff and it can be more easily injured during sex. And so I will see a lot of guys who come to see me who have ED that's pretty severe. Pills don't work, things don't work, and they have penile curvature. Well, for a man with Peyronie's disease and ED, a penile implant, which we'll talk more about, can be the ideal treatment. So Peyronie's disease is curvature of the penis with an erection. It's not dangerous and we can absolutely treat it. Okay. And we'll talk more about implants in a minute. Let's go ahead and go to the next slide. There we go. How do we treat ED? It is absolutely treated, and there's a variety of treatment options. When a guy comes to see me and has erectile dysfunction, my goal is not to talk him into something. My goal and my job is to say, okay, you've got erectile dysfunction. How can we treat it? And really, if you go see your primary care doctor, he or she can certainly be helpful. A lot of times, men will end up seeing me, a urologist, a urologic surgeon who specializes in sexual function to get the best treatment, but you can certainly start with your primary care doctor. How do we treat it? We got different treatment options, and you can see on the picture there we have pills. There's something called a vacuum erection device. There's something called penile injections, and there's something called a penile implant. We're going to talk all about all those, and let's start first by talking about pills or oral medications. Okay, this first slide here, if we go back, let's go ahead one slide. There you go. Talks about lifestyle changes. Here's the deal. Having a healthy lifestyle, eating a healthy diet, low fat, getting exercise, not smoking. Are those things really important? Absolutely. But if you got ED, you're probably not going to change your ED by any of these things. But we do have treatment. So let's go ahead and start talking about those. Next slide. There we go. Pills, oral medications. Everybody's heard about Viagra, the little blue pill. You've heard about Cialis. These medicines are called PDE5 inhibitors. That's kind of the family of the medicines, and they can work really well. Pills, oral medications, are first line treatment for ED. How do these pills work? Well, what they do is when you take one of these medications, they improve blood flow into the penis when you're sexually aroused. So what that means is if you take a pill and you're not sexually aroused, nothing is going to happen. Okay. It's only when you get turned on, when you get aroused, that the medicine will help improve blood flow into the penis and hopefully make your penis stiffer. And a lot of guys get great results with these. They can have side effects, like, for instance, if I take Viagra, I get a really big headache. Not dangerous, but it's not very pleasant. If I take Cialis, it works great. Some guys can get facial flushing, in other words, kind of redness in their face when they take these medicines. Sometimes they can upset your stomach. So any of these medicines can have side effects, but I'll tell you, they're very safe. I mean, there have been millions and millions and millions of men who have used these medicines. They're safe medicines. You never want to take these medicines without talking with your doctor first, but pills can work really well. You have to take them, usually about an hour or two or three before sexual intimacy because it takes a little bit to get into your bloodstream, but they can work really well. And for a lot of men, they're a great place to start, but they don't work for everybody. For some men, they don't work well. And then we have other treatments that we can go to. There's something called a vacuum erection device. And a vacuum erection device is just like this picture is showing you. It's a plastic cylinder that goes around the penis, and that cylinder will then form a vacuum, and the vacuum pulls blood into the penis. And then what you do is you put a rubber ring, I'm just going to use the common term, a cock ring, around the base of your penis to hold the blood in. For some guys, that works pretty well. For some guys, it doesn't work so great, but it's non-invasive, very benign. Me and my male nurses, we in my ED clinic, we work with patients on this. It's not a bad way to start. I think probably 40 to 50% of the guys who try a vacuum device think it works well enough and for their sexual function, but it is something you can try. Okay. We have other treatment options. There's something called penile injection therapy. And yep, that's exactly what it sounds like. It's where me and again, my nurses, we work with men and we teach them how, when you want to have an erection, you actually use a very small needle and syringe, like a diabetic might use for insulin, and you inject medicine into the penis. Okay, this sounds like the worst idea ever, but I've injected myself a bunch to see what it's like. It's not bad. It's a little sting, but it's not bad. The medicines that we inject, they're not simply like liquid Viagra or liquid Cialis. They're actually very different medicines. And what these medicines do is when you inject them into the penis, they immediately begin to cause blood to flow into the penis. And so the idea is you inject the medicine. In about 10 minutes, you get a nice hard erection that allows sexual intimacy. And what we have to do as urologists and physicians is try to find the right dose and strength for a patient so that when you inject, in about 10 minutes, you get a nice hard erection that lasts about an hour and then goes away. Because what you don't want is an erection that lasts 2, 3, 4, or 5 hours. That may sound like a great idea. And for the first hour, it ain't so bad. But after that, it gets pretty uncomfortable. That's called priapism, an erection that won't go away. So if you inject too much medicine or you don't have the right strength, that can happen. But injection therapy is a way to treat ED. It can work well. A lot of guys who start injections will eventually stop. They get tired of sticking a needle into their penis, but it's a viable way to do things. And then we also have penile implant surgery, a surgical treatment for ED. And I want to tell you that when I was going through training and residency 25 years ago, we used to say, listen, a man has to try pills first, and then they've got to try the vacuum, and then they've got to try shots, and then they can move on to surgery. But we don't feel that way anymore. Really, we think men ought to try pills as the first step, but after that, it's whatever they want to do next. In other words, I had 2 or 3 guys come see me today. They've tried pills, they don't work. They don't want to do injections. They don't want to do vacuum. They want to move right on to surgery. That's absolutely acceptable. And the reason they want to move on to surgery is that penile implant surgery really, really works well. As a matter of fact, for all the different treatments for ED, pills, vacuum device, shots, penile implant that we'll talk more about in a second, penile implant has the highest patient satisfaction. Again, my job as a surgeon is not to talk you into surgery, it's just to give you options. But for some men, the implant works well. And what an implant is, you can see in that picture there, what an implant is, it's completely inside the body, and penile implants have been around for almost 50 years. What they have are 2 inflatable cylinders in the penis. It's got a pump that's down in the scrotum, and that pump is shaped kind of like your thumb. And then it's got a reservoir that's up in the abdomen that holds sterile water. It's a hydraulic system. If you look at a man with a penile implant, you can't tell. If you're buck naked and let's say you went to the Y or to the gym and worked out and you were sharp, no one can tell you have an implant. The way it works is when you want to have an erection, you reach down to the scrotum, you or the person with whom you're having intimacy, you reach down to the scrotum and you push on that pump. And as you compress the pump, it pulls fluid from the reservoir into the cylinders, and that makes the cylinder stiff. It takes less than a minute to pump up an implant, and what it does, it makes the shaft of the penis nice and hard to allow intimacy. It doesn't change sensation. It doesn't change urination. All it does is make the penis hard. When you're done with intimacy, and you can leave it pumped up as long as you want, when you're done with intimacy, you push on the little valve, push on the pump again, a little valve opens, and the fluid moves out of the cylinders. Patients will say, well, listen, does the implant work for any kind of intimacy? And the answer is yes. It works for oral sex or anal sex, vaginal sex. It works for intimacy, just like a normal erection. It's really an effective way to treat ED. And if you look at the pictures here, pretty much what we're talking about mostly for me is that middle picture there. It's called the AMS 700. That's the name of the device. It's the penile prosthesis. It has a pump attached to it. You'll notice that golden color of the device, that's actually antibiotics impregnated onto the surface of the device to reduce the risk of infection. And that's what I implant in probably 98% of my patients. Let's go on to the next slide. And there you go. That shows exactly what's going on. You've got the cylinders in the penis, the pump in the scrotum, the reservoir up in the abdomen. And I can usually get that in through a single small incision that's probably, I don't know, 2 inches long. I usually make that incision above the base of the penis, but we put everything in. It's outpatient surgery. Patient goes home same day. It works really well. Do me a favor. Can you go back to the prior slide? Because one of the things I wanted to say, sometimes men will say, well, doc, you got this pump in the scrotum. I got 2 balls down there. Is there enough room for everything in the scrotum? And there is. No question about it. There's plenty of room for everything down there. Implants are great. And what we're going to do next, let's do this. Let's go to the next slide. And then let's go to the slide after that, because before you move on to the next slide, this is a little schematic, a little video, but I want to go to the actual video of the patient inflating and deflating his own device. because this is a patient, a buddy of mine who's a urologist out in California, Dr. Ed Cartman, who's a tremendously good surgeon. This is one of his patients that he put a penile implant in, and this patient was kind enough to allow us to film him inflating and deflating the device. And so I think this is a great video for y'all to see. And this thing will start running here in a second. Eddie tells me this patient is very proud of his implant. Like sometimes men who get or women who get breast implants want to show their friends, well, this guy shows everybody who will take a look at it. But he has done very well, and he's helped a lot of men really understand about what a penile implant is. And so when you look at this patient here in just a second, he looks very normal. I mean, this is with the implant deflated, and what he's going to do now is inflate it. And so he's reached down to the scrotum, and with his right hand, he's using that to kind of compress the pump. And that doesn't hurt at all. And as he compresses the pump, that moves fluid into the cylinders, and that makes the penis stiff. And you can see that as he pumps this thing up, the penis, it's a normal looking erection. And those cylinders that we put in, we put the longest cylinders that fit at the time of surgery to give a good, healthy, rigid erection. And now he's going to deflate it for us. And you can see what he's doing. He's pushing on there's a little button, a little valve on the pump. And we teach you how to use this thing. You push on that button, and what that does, it opens a little valve, and the fluid goes from the cylinders back to the reservoir. And you can see the erection is going away. So the fluid just cycles back and forth from the cylinder to the reservoir. And a lot of times patients will do this. They'll just kind of gently compress the penis, or he's folding his down just to get the fluid out. But look, he's back down to normal looking again. A man who has an implant can do anything. In other words, the implant doesn't limit their activities. I got patients who like to ride bikes, they like to ride motorcycles. I got a patient who has a penile implant who's a cowboy. He rides in rodeos competitively, and it's not a problem for him. I asked him if he ever had the thing pump up when he was on the back of a bull, and he said no. But that does not limit her activities. It's a great way to treat the right patient. And the right patient is the man who's tried other things that has not worked for him. It really works well. Look what that says. 95% of patients are satisfied for intercourse. They're very happy with it. And I will tell you, when a guy has a penile implant, when it wears out, because they do wear out, usually 7, 8, 10 years, the things wear out and you have to replace them. When a guy has an implant, let's say he's at home one night and goes to pump it up. If it won't pump up, about 2 minutes later, he's paging me saying, hey, doc, when can we get back in the OR and replace this thing? Because patients are so happy with them. They work really well. All right, if you have the surgery, for me, it's an outpatient surgery. Patient comes into the hospital, has the surgery, goes home the same day. Like I said, usually, not always, usually we can get all that in through one incision. I tell patients to take it really easy. When they go home, I give them a prescription for antibiotics. For the man who's not diabetic, the risk of infection is probably 1%. For the man who is diabetic, maybe it's 2 to 3%. It's not 0%, but it's low. The risk of serious bleeding is really low, and we bring our patients back to the office at 4 weeks after surgery. We teach them how to inflate and deflate the implant, and then you can begin to use it for sexual intimacy. It isn't, like I said, it's an outpatient surgery, and patients do really well, do very well with it. We can go to next slide. Is it covered by insurance? Yeah, for the most part it is. Not always. Medicare always covers at least a percentage of it, a good percentage, and then the private picks up after that. But before we schedule a surgery, then we always check with insurance to make sure it's covered. Now, it may be that a patient has a deductible to meet or that kind of thing, but usually implants are covered by insurance. All right. It is a great way to treat ED. It's not the only way. Like I said, we have these other options, but it's a great way. And I'll tell you what, I will tell you that the wives or girlfriends or whatever the case is with a man who gets a penile implant, they tend to be happy for their partner because they say, listen, I know how much he was suffering emotionally as well as physically, and it just kind of changed things between us. And that's great. What I do tell patients is if you have a marriage, for instance, or a relationship that's suffering because of other reasons, an implant is not going to all of a sudden make a bad marriage or a bad relationship better. So we have to be honest about things. What an implant does, it allows sexual intimacy. It's not the answer to all the questions in a tough relationship. But if part of the issue is sexual dysfunction, the implant can really help. Implants are great. Like I said, There are two companies that make penile implants that we deal with in this country, and Boston Scientific, which makes this AMS 700, in my opinion, is the best. If I was going to have one done, that's what I would have done. Absolutely no question. They work really well. Let's go on to our next slide. Now, can you have, every surgery has risks to it. Probably the biggest risk to implant surgery for the patient is going to be infection, because if a medical implant of any type, an artificial knee or a heart valve or a penile implant, if they get infected, you got to remove it. That risk in a man who's not diabetic is really low. 1, maybe 1.5%. For a diabetic, maybe it's 2 to 3%. Like we said, these implants always wear out. At some time in the future, the implant is going to break down and need to be replaced. Again, usually we're talking 8, 9, 10 years down the road. I had a man come in to see me last month. I put his implant in 15 years ago and it's finally worn out. But usually 7, 8, 10 years, you're going to have to think about replacing it. And replacing it means we take out the old one and we put a new one in. So anything's going to have complications, but they're pretty rare. A lot of guys have ED. A lot of couples suffer from ED. You don't have to suffer. We can treat ED. I tell men who come to see me that virtually always I can get him back to having a good stiff erection to allow intimacy with the person that he loves. Now, how we get there, maybe he wants to try pills, maybe he wants to do injections, maybe he wants penile implant surgery. We can treat ED. First step is for you coming in to see me or coming in to see a good doctor. Good urologists are out there. Find someone who knows about sexual function and men's health and go see them. Next slide. And next slide after that. Good. I think what we can do now, go ahead and advance. I think we should open this up for questions because I'm sure there are going to be folks who have questions. What kind of questions do you have? And I'll try to answer as many questions as I can.
So much, Dr. Christine. What an awesome, informative presentation. So we have a handful of questions that have come in, and I think some of them have maybe been answered throughout the presentation, but I'm going to ask you to just re-answer them to make sure everybody gets what they need.
For sure.
So the first question that's come through is, I'm hypertensive, which is controlled by medication. Can that medication cause ED?
Yeah, that is a good question. And so we know, like we said in the presentation, that diabetes and hypertension, high blood pressure, are probably the two most common medical diseases that can lead to erectile dysfunction. And we know that men who have hypertension, it's really important that you take your medication because hypertension can be a killer. You don't want to not take your medicine. Certainly, we see patients who say, listen, I started taking this medicine for my blood pressure and now my erections are worse. And yeah, that can happen, but don't not take your medicine. Come to a urologist, come into someone like me. We will be able to treat your ED, but you don't want to stop taking that medicine.